Praise the Lord, my brothers and sisters. This is Apostle Joseph Stafford bringing you MFHM Talks podcast. We're here today to bring the program called Multiple Myeloma and how it affects Black people. We have this program online at least twice a month to talk to you about things that are effective in dealing with various diseases. Right now, we're focusing on multiple myeloma because the person who put the program together is Robert Lasco. And Mr. Robert Lasco had been diagnosed with multiple myeloma and developed an educational fund to help in this endeavor to get people educated about how to deal with multiple myeloma, with directives on where you can go, that kind of thing as well. He's been put in position to where he is now a advocate and a sponsor, or part of the sponsorship for a book called Standing in the Gap, GAAP. And that helps give more and more of the story, what's going on in respect to multiple myeloma and how it affects Black people in general. So we'll talk about that in a moment because we don't want to seem prejudicial, but we have to look at the idea of what's really going on and why it seems to be an anomaly in our Black community. So let's begin. Robert Lasco is the Chief Executive Officer and founder of the Lasco Cancer Fund, doing business as Multiple Myeloma Education Fund. Robert Lasco is a founded this 501c3 nonprofit organization in 2014. After being diagnosed with this cancer, multiple myeloma, the organization was birthed. Robert is passionate about bringing education and awareness about multiple myeloma to society at large. Robert has partnered with several pharmaceutical companies as a spokesperson for multiple myeloma in the African American community. Robert Lasco and his wife Sharon Lasco are both advocates for a cure for multiple myeloma and effective treatments. Previously, Robert Lasco worked for the city of Charlotte as a manhole inspector and served as a minister in a local church. He has always been passionate about serving others, and he looks forward to continue this path as a multiple myeloma advocate. A telephone number to contact him at is 704-953-5004. And there's an email address that I'm not privy to right now that I can share with you later. But if you need to contact him, you can do it through me. My email address is mfhminc6@gmail.com. mfhminc6@gmail.com. So as we move forward, we want to talk about the organization to find out what it does. Basically, the program, again, multiple myeloma education fund, has a vision and three light programs. So let's talk about them briefly. The vision statement is to provide hope and educational awareness to individuals and families affected by multiple myeloma and other cancerous diseases, while endeavoring to provide the most innovative resources through sustaining partnerships within the global medical community. The First Light program is designed to bring awareness of education about multiple myeloma to the general public. The Second Light program is designed to teach patients who have multiple myeloma about patient lifestyle issues, disease overview management of complications associated with multiple myeloma, and community resources. The Third Light program is designed to formulate discussion between medical professionals about clinical trials, research methodology, and effective ways to treat multiple myeloma. So the question would be, what is multiple myeloma? Multiple myeloma is the type of cancer that starts in the plasma cells. These cells are a type of whole white blood cells. They are in charge of producing antibodies, a vital part of your body's immune system response. When you catch a cold or virus, antibodies allow you to fight the infection. These cells are mostly found in the bone marrow, though they can be found in other organs and tissues throughout the body. Abnormal plasma cells in the bone marrow may behave in unusual ways. They may begin to divide at a rate faster than normal, leading to the generation of more abnormal plasma cells. These specific changes may lead to multiple myeloma or a precancerous condition. A precancerous condition is not yet cancer, but is likely to cause cancer in the future. The symptom and signs for multiple myeloma can be different on case-to-case basis. In some cases, no symptoms present themselves and makes multiple myeloma very difficult to diagnose. However, there are still a variety of symptoms that may present themselves. Some of these symptoms include bone pain. Bone pain is especially common in the chest or in the spine area. Weight loss. This can be a common symptom of many conditions. Loss of appetite. Well, this symptom tends to go together with weight loss, but it can be difficult to eat while on a multiple myeloma. Excessive thirst. In contrast to loss of appetite, multiple myeloma can cause those suffering from it to feel a consistent need to drink. Nausea. This common symptom can be present with multiple myeloma. Confusion. This has been declared or described as mental fogginess by some who suffer from it. Constipation. Multiple myeloma can cause people to feel constipated. Frequent urination. Well, not surprisingly, this symptom is often linked with excessive thirst mentioned earlier. Weakness. People may feel numb or weak throughout their legs. Fatigue. Arguably the most common symptom of this medical condition. Fatigue is a likely symptom. So as we go through the process of figuring all these things out about multiple myeloma, I'm going to use the book called Standing in the Gap. And we're going to talk about some things that are in this book. We're going to pull a portion out of it and talk about it. It's called What's Different About Multiple Myeloma for African Americans. And as I go through this process here, this should give us some information to look at and some rationales as to why things appear the way they appear. So, it's more common. Multiple myeloma is a rare cancer, yet African Americans are twice as likely to be diagnosed with multiple myeloma than white Americans. The reason for this is not completely understood. See, there are more than 2 times of African Americans incidence of the rate of multiple myeloma. So in other words, twice as much as any other race. Yet it remains a rare cancer. About 6,000 African American patients were estimated have been newly diagnosed with multiple myeloma in 2016. African Americans make up a significant number of Americans living with multiple myeloma. We have African Americans currently represent 20%, or 1 out of 5 patients living with multiple myeloma. The U.S. African American population is expected to grow much more quickly than the white population. Because of this, African Americans will make up even more of those living with multiple myeloma in the future. It is usually diagnosed at a younger age. African Americans are diagnosed with multiple myeloma at a younger age. 71 years average age is diagnosis for white Americans, whereas with African Americans, 66 years is the average age of diagnosis. Some studies suggest that the type of multiple myeloma that affects African Americans tends to be less aggressive with a better prognosis. However, it's still important that you seek proper care. African Americans are less likely to have access to appropriate care. African Americans with multiple myeloma have benefited less from survival improvements in recent years. This might be because African Americans may not have the same access to treatments. However, when treatment for multiple myeloma, African Americans do just as well as sometimes even better than white Americans. You deserve it. Talk to your doctor about how you can get the best treatment for you. So basically, what we're saying today is that the opportunity for help in this particular spectrum of need comes with you. You wanted to get better. You wanted to do things necessary to get your life better. You got to want it. So you have to work for it, go after it, which means that when you get diagnosed with multiple myeloma, ask the right questions. Go to your doctor, find about other doctors that can assist the doctors moving forward, and help develop a village around you so you know what you can do in respect to your medication, your diet, exercise, all those things is necessary in order for you to fight the disease appropriately. I also believe that even beyond that, if your faith is in the position to where you believe God is your healer, your restitution comes better, because as long as you're positive about how you receive a thing and how you act accordingly to it, that also helps you get the answers you need for your healing, for your, I guess what they call in aspect of the disease fading away is remission, to where you don't have the effect of that disease anymore in your system. So remission, healing, all that is important. I mentioned the aspect about the mentality that you have of your faith in God, is that when you have tendencies of doubting what's happening and then go to the woe is me scenario, you have to come out of that and start speaking positive things concerning yourself. These are things that I teach a lot of times about. Our words have power, and there's an effect on the words that we speak, so that we're saying what God is saying concerning our deliverance. So, my friends, I pray that what information I gave you today is beneficial, and they will bring you to a point to where you can understand what's going forward and be able to move in the direction of your healing. Remember, find out what's going on with you. Talk to your doctor, ask questions. If there's some reason you can't ask the questions, get somebody to go with you, ask all the questions that are pertinent, which means that a lot of times, as you heard earlier in the reading, that many of us African Americans do not get the proper care because of financial insecurities. But if we ask the right question, is there a grant or sponsorships or things out there that will help pay for my treatment? Those answers are there available to you. And yes, there are some things out there. Ask the doctor again, shall I see another doctor on this, a hematologist or oncologist, so I can make sure my blood is doing what it's supposed to do? Because you picked up the disease, but what's going to keep it to where it's in check? What are some of the practices and things that can help me go better? Are there certain type of medication I can take? If I'm taking certain medications, what are the side effects of the medication? Is there a restriction on foods I can eat based upon the medication I'm taking? Will it have an adverse effect on me? All these questions are very important. So if you don't have those questions available to you, you can always go to myeloma.org. And there's a questionnaire in there that a question you can bring to your doctor. Ask those questions, even about everything I just mentioned to you concerning your health, your bills, all that's involved with getting you back on course again. And from there, you start building your team, building your village, so that you will have people working with you as you work yourself to get yourself better. So that means that you also have the opportunity to talk about a dietitian as to what the diet I should be on, talk about exercise, what can I do, what can't I do, what is it hindering me on doing? All those questions you want to ask, so that when you talk to your doctor, they can point you in the right direction. One thing I want to say to you, for those that have an intimidation talking to doctors and thinking if you keep things from the doctors, you're better. It's not like in school. You hide your papers from your teacher, or you come with a lie, basically, to say you're doing something that you're not. You have to realize that the doctors work for you. You do not work for the doctors work for you. And if you work with them and they work with you, you then build your village to get the answers you need for your healing, for your redemption in the situation. So, my friends, I've only been here 14, 15 minutes with you, but I hope and pray that these words are beneficial to you to help you go the right direction in your advocacy in respect to your healing in this particular dilemma. Multiple myeloma is one of the cancers out there, the other cancerous things out there that comes with similar reactions. So the key here is that you want to make sure that no matter what it is that's come up in your system, the things I just mentioned to you are basic things you need to do to get things turned around. Don't let finance be a stopping point for you. Don't let the history of our race and how some of us will use as lab rats be a stopping point for in this day and time you have the opportunity to go from a doctor to another doctor, get a second, third opinion if you believe that that's the case. But you need to be active in building your team around you so you can then get better and be a very, very valuable part of our society. So, my friends, I bid you good speed. God bless you and let heaven smile upon you. We are going to take a break right now. We'll be back within about 45 minutes with a program called Fatherhood. We have a conversation available for those that are online that can get on with us and talk about the things that are necessary concerning your walk with God. God bless you. I bid you peace.